Welcome to Milwaukee Emergency Center for Animals, and this is our fairly new hospital. We're 2.5 years old. We started here in June of 2009, and this is a specialty hospital where we perform critical care. We do dentistry, different specialties like behavior, rehab we're going to start up here, and have everything under one roof, just like you see in the new wave of medicine as Froedtert Hospital. We have 7 exam rooms. Each exam room has exam room table and a sink, picture counter space, a chair for the owners to sit down on, and a chair for the veterinarian to sit down on, so we can do consultations. And then our last exam room is exam room number 7. This is primarily used for visitations. We've even had people staying here overnight. We also use this as our private euthanasia room. And then we have the centralized location of the treatment area where the animals are initially brought to start treatments on them, decide what is going to happen with them. Are they going to stay in the hospital and go to the ICU, or are they going to stay in a treatment room cage and go home in the evening time? This cat had a rhinoscopy done on him, so we put a scope up his nose and got some tissue samples of him, so he's an outpatient. Right off the treatment room, we have all of our other areas. This is X-ray. It's digitalized, so we can get very good pictures of animals. This is our endoscopy room. We just did the rhinoscopy this morning. We do endoscopy in here, bronchoscopy, rhinoscopy, and different general procedures. Our full service lab, where we can get blood work within 15 minutes. Any type of blood work necessary. Urinalysis. We have our full service blood bank here too, where we have blood products for cats and dogs. So this is for a cat and this is for a dog. We have blood donors coming into our practice, and they will give blood here. And then we keep it in our blood bank and give it to animals that need surgery or were hit by a car or are low blood cell count from some disease processes. And then we have our surgery room back here. There's 2 prep tables where we prep the animals on, and then our surgery rooms that has all the fancy surgery equipment that our surgeon uses. And then we enter through the ICU through a sliding door, and then our patients are kept in here. Some of the smaller patients over here. If we have cats, we try to keep them over on this side. Smaller dogs on this side, and larger dogs in the big cages. The exotics room is here. So right now we don't have any exotics in-house, but we keep birds in these incubators, and then rabbits and guinea pigs, and we get snakes and turtles, hamsters, gerbils. I mean, we see all kinds of exotics. We're very well known for it here at Milwaukee Emergency Center for Animals. Most of the hospitals in the area will not see any exotic pets. And then we have one last area, which is our isolation room. Everything is glassed in so a technician can see all the areas. You can see into the isolation, and you can see all over the ICU area.